Hello, my name is Megan Fink. This is my Nursing 335 clinical presentation, and the purpose of this video is to explain how I met all 8 objectives throughout this semester. Objective number 1 is to utilize previous knowledge in sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I was able to meet this objective through my peer leadership opportunities with a clinical group on the mom-baby unit, as well as another clinical group on the peds unit. For mom baby, I felt I was able to really help them kind of explain what everything was. I was able to help them read fetal heart rate monitors. I was able to kind of get them into different experiences. I saw a circumcision happening, so I kind of saw the first student I had and said, hey, this might be a cool thing to watch. I was able to explain some of the different findings, why they would be on magnesium sulfate for preeclampsia and what they need to check. I was able to just help them kind of reinforce what they were learning in class and be able to put it to the practical experience. On the peds unit, I was able to help the students learn how to take assessments and vital signs, especially on infants. A lot of them were very nervous, and it was nice to be able to go in and say, okay, so what is your head to toe? What would you do first? And kind of watch them work themselves through it and not necessarily tell them what to do, but allow them to think through it, and just kind of guide them to the necessary steps that they would have to take on an infant. Obviously, you can't ask an infant, hey, what's your name and date of birth? But trying to figure out how to assess an infant's level of consciousness if they understand kind of what's going on, if they look at you when you talk to them, if they, your reflexes. It was really nice to be able to see how I could help the students put all of the knowledge they were learning in class to the practical clinical experience. I also was able to use some of my previous knowledges from my dance minor in my holistic tap class. I was at first shocked that the ladies in that class could move. I felt a little behind at times, and I am maybe a quarter of their age. But I was able to help some of the newer kids in the class, really just kind of keep them involved, keep them engaged, just kind of try and do my best to help slow down what the teacher was teaching to allow the newer students to really just kind of engage and still have fun, and not get so overwhelmed that they couldn't get any steps. Objective number 2. Apply the basic principles of ethics and management to meet the challenge of an ever-changing healthcare environment. I felt this was done in my interprofessional day at Luther Crest. I was with the nurse Rhonda, who had just got promoted to sort of a manager, and she was explaining to me how difficult it is to give patients that have very little independence, the independence that we all need and we all crave. She was really trying to help me figure out and feel how all of these patients that are total care patients have their autonomy preserved. And it was really interesting to see how Rhonda really tried her best with every patient that she saw, every nurse that she talked to make sure that everyone felt safe, everyone felt heard. And I think that Rhonda was really just trying to help give everyone the autonomy that they all wanted, give them the right to make their own decisions and just feel human. And I really respected her with that. I think that trying to do that is such an important job, especially when you are taking away so much independence from a person who can't do much for themselves. Objective number 3, demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. I believe I was able to complete this objective in the way that I handled myself regarding all of the experiences. I was very polite and professional in all of my email correspondences. I made sure to introduce myself, the fact that I was a senior nursing student from Cedar Crest College, and kind of why I was emailing them, that this was an experience for my leadership class, and what I was kind of looking to gain out of the experience, as well as the times that I would be there. I was always very respectful when I was at any of my outside experiences, just trying to make sure that I was absorbing as much as I can, asking questions when appropriate, and not being rude to anyone I encountered, regardless of if they were rude to me. I just tried to be professional in every interaction that I had, as I was there as a guest, and I did not want to kind of just be overbearing. I wanted to learn, and I did my best to be respectful with every opportunity that I had, every interaction, and I believe that I achieved this objective through that. Objective number 4, critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. I found this in an article titled "A Thematic Analysis of Self-Described Authentic Leadership Behaviors Among Experienced Nurse Executives." And this article really kind of stood out to me because it really asked how nurses foster their healthy work environments from experienced nurse leaders. And to me, that was really kind of impactful. A lot of what the nurse leader said is self-awareness is such a huge key, knowing your private self and how to handle that self, as well as your professional self and how that's the self that everyone sees and everyone really kind of projects themselves to. So understanding where you lie on that and being self-aware of everything you do is such a huge part of creating a healthy work environment, as well as balanced processing, transparency, and having a moral compass. I think that all of this article really was just trying to explain how a healthy work environment ultimately benefits everyone, and all nurse leaders want to have such a healthy work environment because ultimately it benefits everyone. This article really reminded me of something that I had read in our textbook by Sullivan, and it was that it seemed like all these leaders tried to be transformational leaders. They wanted to emphasize the importance of professional relationships, especially in the transparency and balanced processing. They wanted to just hear out all of their nurses. They wanted to understand their nurses, and they really wanted to connect with them and build that trust, which is such an important part of a healthy work environment. Objective number 5, function as a competent patient advocate, nurse advocate, and change agent. I felt this was achieved through my advanced practice day with Chantel Bronco. She was very adamant that she would never ask any of her nurses to do anything that she could not do. Chantel really was an advocate for her nurses and a change agent, which ultimately led her nurses to feeling confident that they could talk to her and advocate for their patient. Chantel made sure that every skill she asked any of her nurses to do, aside from the wound care nurses, that's a different specialty, but any of her nurses on Ohu or Tohu in Lehigh Valley Cedar Crest, that Chantel could do all of those skills. She wasn't asking too much of them, and if the nurses came to her and said that she felt she would do what she could to change that and make sure that her nurses felt heard. Objective number 6, formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. I think this was achieved through my continuing education. I know I'm going to be having a lot of continuing education over the years, and I think continuing education is really important. I watched a lot of podcasts. I went to a Dine and Discuss held by the SNA on human trafficking. I watched a crime webinar. And ultimately, all of my biggest takeaway was that you need to advocate for your patient, and you really need to enjoy your work. And advocating for your patient will help you enjoy your work. It will be more satisfying, and there are terrible things that happen in this world, and unfortunately, nothing that we are going to do is going to stop those terrible things from happening, but we can help lessen the impact those terrible things have on people, as with the human trafficking. SNA Dine and Discuss. As a nurse, you can be there to support your patient as best as you can. It's an unfortunate situation that I wish was not a situation that we would have to handle, but unfortunately it is something that we do have to handle, and I think having compassion and being a nurse, you really have that power to touch this person's life in a way that can benefit them for the good. Objective number 7, recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. This was achieved through our day in Harrisburg. I think my biggest takeaway from our day in Harrisburg was that nurses have a voice and we need to use it. The PSNA was our last speaker of the day, and what really struck me, that was the conversation that definitely struck me the most. And I think what struck me the most was that they wanted to help, but they're not nurses. They only know as much as we tell them. So the bill they were working on was safe patient staff ratios. And without a nurse like opening up that topic and saying, hey, this is an issue, we need to fix this, how would PSNA know to make those bills, to try and get them passed? Nurses have a voice and we need to speak up if something is unsafe, if something is unethical. We need to speak up in order for any change to occur. And I think that was my biggest takeaway from Harrisburg, is that nurses have a voice. And in order for that voice to be heard, we need to speak up. We need to tell someone when things are not right, when things need to be changed. And that does lead to voting. We do need to vote for those officials that are going to align with what we believe, that are going to help us go through everything and really work in our benefit to help make the healthcare profession a better place, a safer place for everyone involved. Objective number 8, predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I think the biggest place that I saw ethical dilemmas, and this is possibly the biggest place for potential ethical dilemmas, was my day at the prison. The nurses just were not very nice. I tried to be polite and respectful, and while I was only there for 8 hours and I did not know these prisoners, which I'm sure all of the nurses did, the nurses just were not very nice. And maybe it's just the way they had a stressful day. There could have been a lot affected that, but I felt like regardless, as a nurse, you're supposed to be compassionate. The ANA provision number 1 states that the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. The inmates are still people. They should still be treated with compassion, with respect, and I just didn't feel like the nurses were doing that. I also did not feel like the nurses were doing that to each other, and their coworkers are also people. I think that it's really hard for me to see that type of work environment. I heard a lot of complaining from one nurse about the different doctors, about the different nurses not being competent, about how the inmates are just not pleasant, and it really didn't match what I was seeing, so I was very confused. But then again, I was only there for 8 hours. I do not know the ins and outs of the prison and how that healthcare system works, but it really was an ethical dilemma for me to be able to sit there and watch coworkers put down other coworkers, put down the inmates, and just not treat each other very nicely. As a nurse, you're supposed to be there for people. You're supposed to lift them up. You're supposed to help them, be compassionate, and respect them, regardless of if they are your coworker, an inmate, a patient at a hospital, a hospice patient, homeless, regardless of their population, race, ethnicity, anything like that. They're still a person. They should still be respected and treated with compassion. I thank you so much for paying attention to my video and my explanation of how I met all 8 objectives throughout this semester. I hope you enjoy the rest of your day.